Our organizational strategic planning project is the Willpower Teen Center, located in Kent County, Michigan. The group's members include Stephanie Gullidge, Sheila Lucas, Denise Lyon, Shelley Meyerholtz, Kim Prue, and Jessica Riley. Teen pregnancy is a problem across the country. According to the United States Department of Health and Human Services, Michigan ranked 33 out of 51 states in the District of Columbia on 2010 teen birth rates among females between the ages of 15 and 19. Many teens feel insecure asking questions and gathering information regarding intercourse, pregnancy, and contraceptives. Willpower Teen Center was created so teens could have confidential access to preventative and supportive pregnancy-related information. The center helps those who want to prevent pregnancy and those who have it unexpectedly conceived. The Michigan Public Health Institute states Kent County has the fourth largest population within the state of Michigan. The 2011 Kent County Health Needs Assessment shows Kent County with a lower employment rate and higher educational rate when compared with other counties in the state. Despite this finding, 1/5 of the children in Kent County ages birth to 5 were living in poverty, and almost half of the female-headed households with children less than 5 are living in poverty. This statistical evidence indicates that teen pregnancy is an appropriate choice for a community nursing intervention due to high rates in Kent County in comparison to rates overall in the state. The national benchmark for teen pregnancy is 22, half the rate of Kent County. Current resources within the community include school sex education, Planned Parenthood, Michigan Teen Pregnancy Prevention Initiative, Reducing the Risk, and Talk Early and Talk Often workshops. These agencies and programs focus on sex education, use of condoms, birth control antepartum and postpartum. While assessing current trends and examining the existing resources available, we decided to create a center focused on teen pregnancy prevention in Kent County due to the high rates of teen pregnancy. Our observations suggest that more teaching and education are needed for pregnancy prevention and that the community would benefit from a resource center that provides access to information for teens that are pondering sexual activity. The Willpower Teen Center will open as a nonprofit organization serving the Kent County area. The center will provide education and resources for teens hoping to prevent pregnancy and provide assistance to those already pregnant. Information provided will include Medicaid enrollment for expectant mothers, women, infants, and children, WIC, along with maternal infant health programs offering interdisciplinary services to expectant mothers. The name, Willpower Teen Center, was chosen because we want to give teens the willpower to overcome the peer pressure of having sex and risking pregnancy. Here is the Willpower Teen Center's mission statement. The philosophy of the center is to provide ethical and confidential care within a safe environment. By providing up-to-date information, we will empower our clients to make the most informed and healthy choices. We will offer support and compassion with every client interaction. We will present information which inspires values such as compassion for others, nurturing of relationships, and promoting responsibilities. We realize a teen may find difficulty talking with a parent or adult about sex, so we strive to provide mediation in a non-judgmental environment, facilitate understanding and acceptance between parents and teens. Willpower has several organizational goals. It is our hope to reduce the number of teen pregnancies in Kent County, promote community awareness of pregnancy rates and the need for pregnancy prevention programs, provide resources for pregnant teens, provide services free of charge to all clients, and to support the mission statement and philosophy of the center. Here is a list of the organizational objectives. Willpower Teen Center staff will consist of a board of directors, an executive director, registered nurse case manager, nurse educator, social worker, financial manager, office assistant, human resources and marketing manager, and community volunteers. The board of directors will be responsible for the oversight of the Willpower Teen Center and govern the organization's efforts to fulfill its mission. Board members will create policies for the center as well as adopt and supervise the annual budget. Board members are expected to attend and participate in regular meetings and represent the center in community events and act in the best interest of the organization when making decisions. The executive director will be responsible for the day-to-day operations and management of the center. All managers and office personnel report to the executive director, who then reports to the board of directors. The executive director must be knowledgeable in all aspects of nonprofit organizations, as well as finances, marketing, healthcare regulations, and staff management. The nurse case manager will provide quality patient care via the development, implementation, and evaluation of individual client needs. The case manager will act as a liaison between the Willpower Teen Center, client, and families, and will follow established professional standards of care, center guidelines, policies, and procedures. The nurse educator will serve as a client and staff educator, role model, and researcher. Responsibilities include client education, assigning classes and continuing education, planning and conducting in-services. The educator will update staff on the latest pregnancy prevention resources, new forms of birth control, new medications and procedures, as well as maintain up-to-date educational materials and statistical information regarding pregnancy rates. The social worker helps clients cope with issues in their lives, deal with relationships, and solve personal and family problems. Social workers will support clients and families as they guide them toward the ability to understand and weigh the risks, responsibilities, outcomes, and impacts of sexual actions. The financial manager will handle the monetary issues, monitor budgets, and other financial reports of the Willpower Teen Center. Processing payroll, identifying and applying for grant funding opportunities, and soliciting corporate and public donations are additional responsibilities of the financial manager. The office assistant will help maintain structure and function of the facility. Duties include answering the phone, taking messages, creating appointments, greeting clients, and filing documents. Skills necessary for success include good organization, prioritization, and communication. The Human Resource Marketing Manager is responsible for maintaining all facets of employee relations and coordinating the marketing and advertising efforts of the center. The position will organize fundraising activities, manage print production, receipt, and distribution, as well as promotion of positive media coverage for the center. Willpower Teen Center will need volunteers to help connect teens with their individual selves, their families, and their community. Volunteers will be managed by the nurse case manager, but will be assisting all members of the agency. They will be involved in many of the day-to-day operational duties and will help organize fundraisers and planned events. Here is a sample of a job advertisement for the nurse case manager position. The case manager will assess, develop, facilitate, and advocate optional plans and services for all clients. The candidate will also be expected to practice within regulatory guidelines as well as company policy and procedures. Other attributes will include assessment techniques to determine clients' health status, learning style, perceptions of sexual behavior, and knowledge of consequences, home life, and support system. This position provides support and resource information to empower the client to make ongoing independent medical and healthy lifestyle choices. The case manager will facilitate the delivery of appropriate benefits and/or healthcare information which promotes wellness activities. Continuing education within the nursing profession with a focus on teen pregnancy prevention through participation in formal educational programs, conferences, workshops, and professional organizations will be expected. Willpower will run the advertisement for the nurse case manager in the Grand Rapids Press, along with the Journal of Adolescent Health. In the future, we could increase the center's marketing area by running advertisements on MLive and Craigslist, as well as creating a Facebook page for the Willpower Teen Center. The main sources of income for the Willpower Teen Center will come from government grants, fundraising, and donations. Many government programs which offer financial support have been identified through our search. The Teen Pregnancy Prevention Initiative is one program hosted by the Centers for Disease Control and Prevention and the Office of the Assistant Secretary for Health. This program focuses on interventions in reducing teen pregnancy and births in communities with the highest rates of African American and Latino Hispanic youth between the ages of 15 and 19. The Office of Adolescent Health offers a grant program called the Teen Health Project. This program's goal is increasing abstinence and appropriate birth control use through counseling and education. The target is similar to the CDC grant, reaching a majority of minority populations by offering parental counseling and education. Another grant through the Adolescent of Health supports women, expectant and parenting teens, fathers, and their families. This grant is designed to strengthen access to completion of secondary and post-secondary education, improve child and maternal health outcomes, improve pregnancy planning, and reduce the likelihood of repeat teen pregnancies. Another grant identified for the center is from the Family and Youth Services Bureau regarding abstinence education. The purpose of this grant is to provide abstinence education and, where appropriate, mentoring, counseling, and adult supervision to promote abstinence from sexual activity. Projects focus on groups most likely to bear children out of wedlock, youth who are homeless, in foster care, living in rural areas with high teen birth rates, or come from racial or ethnic minority groups. Here is an example of the yearly budget for the Willpower Teen Center broken down into quarters. We focused on reducing the salary cost to the center in the beginning by creating only 2 full-time positions and keeping the rest part-time. We may be able to justify additional salary expense once we have a better understanding of the volume of clients we hope to serve. This cost-effective approach also helps us keep the cost of fringe benefits at a reduced amount during the startup of the center, since salaries are one of the most expensive costs in operating a business. We have examined and justified our additional costs such as rent, insurance, maintenance, advertisement, supplies, and utilities. Taking into consideration we are a nonprofit organization and receive revenue from grants, donations, and fundraisers, we showed no profit for the first year of the center opening. After our research, we determined Kent County could benefit from a pregnancy education center. The Willpower Teen Center was created to fill this need by offering free services to clients. The clinic strives to provide confidential assistance within a safe environment so teens will feel empowered to make the best choices. Willpower Teen Center hopes to create a positive influence within the community by reducing the pregnancy rate in 15 to 19-year-olds in Kent County, Michigan.